Now, we have some red flags to look out for in case you're feeling some of them. It could be something that's coming on. The first one, doctor, would be pain in the extremities.
You got it. So that's really what brings patients to my office most of the time. That's usually nerve pain, and it is not amenable to narcotics. It is not amenable to muscle relaxants. You can't sleep with it, you can't function with it, and that's the kind of pain that minimally invasive techniques now are so good at taking away.
All right, and the next one is recent unwanted weight loss. Really?
So that's a real concerning one. I ask all of my patients if they have that, because look, I don't want to scare anyone, but that's what clues mean to, is there a possibility of a cancer? If a patient is losing weight without a diet, then that deserves attention as quickly as possible.
That makes sense. All right. Fever and chills.
Another important one, especially for Miami, we see a lot of patients who travel to third world countries, and we worry about things like amoeba, fungi, and unusual bacteria that are causing infections. So when patients tell me about nighttime sweats or fevers, common things like tuberculosis need to be considered.
And what about growing numbness and incontinence? Do you see that often?
So thankfully, not often.
Oh, that's good.
And that's another one that's really concerning, because if you start to become incontinent, we only have about 24 hours to get that patient back to normal before it becomes permanent. So I ask all of my patients, do you have groin numbness? And do you have a loss of ability to hold urine, or number two? So for these patients, I would really advise urgent conversation, or at least an evaluation with a doctor.